Is it possible to have erectile dysfunction and still experience morning erections? Yes, it is possible. Morning erections are a normal phenomenon that is not directly related to the ability to achieve or maintain an erection during sexual intercourse. Morning erections occur in most adult men and are caused by a combination of physiological factors, including increased blood flow to the penis. During sleep, especially during REM, rapid eye movement sleep, the body releases nitric oxide, a chemical that relaxes smooth muscles and increases blood flow to the penis. Hormonal changes. Levels of testosterone, the main male sex hormone, naturally increase during sleep, which can also contribute to morning erections. Physical stimuli, such as the pressure of a sheet or contact with a partner, can also trigger morning erections. Pressure on the bladder. A full bladder can put pressure on the penis, which can cause an erection. However, the presence of morning erections does not rule out the possibility of erectile dysfunction. Today, we are going to talk about a very important topic that affects many men around the world. Erectile dysfunction. What is it? What are its causes? And what treatments exist? If you want to know more, stay with us until the end. When we talk about erectile dysfunction, we are referring to the inability to achieve or maintain an erection firm enough for sexual intercourse. It is a more common problem than you think and can significantly affect the quality of life of those who suffer from it. It is not only a physical problem, but it can also affect emotional health and relationships. While morning erections indicate that the body is capable of achieving an erection, erectile dysfunction is a more complex problem that can be caused by a variety of physical and psychological factors, such as vascular problems. Diseases that affect blood flow to the penis, such as diabetes, high blood pressure, and heart disease, are one of the main causes. Neurological problems. Damage to the nerves that control erection can also cause dysfunction. Hormonal problems. Low levels of testosterone or other sex hormones. Psychological factors. Stress, anxiety, depression, and other mental health problems. Medications. Some medications can have side effects that result in erectile dysfunction. Additionally, lifestyle factors such as excessive alcohol consumption, smoking, and lack of exercise can contribute to this problem. Now, to understand erectile dysfunction a little better, we must delve into the mechanics of the erection. One of the most important molecules involved in erectile dysfunction is nitric oxide. Why is it so important? What is the function of nitric oxide in our body? Nitric oxide plays a crucial role in erection physiology, and its deficiency or alteration is directly associated with erectile dysfunction. This is how nitric oxide emerges as an essential regulator of testosterone, influencing both its production and hormonal control. Maintaining adequate levels of nitric oxide through a healthy lifestyle can contribute to optimal testosterone production and overall male health. For this reason, most drugs developed to treat ED focus on enhancing the nitric oxide pathway. Now, let's delve a little deeper into the role of nitric oxide and how it acts in the body. Nitric oxide acts as a vasodilator, relaxing the smooth muscles that line the arteries of the penis. This allows blood flow to increase and fill the corpus cavernosum, generating an erection. It inhibits platelet aggregation. This means that nitric oxide helps prevent the formation of blood clots, which makes it easier to maintain an erection. As a neurotransmitter, it plays an important role in nerve signaling that regulates erection. Nitric oxide is positioned as a fundamental regulator of testosterone, acting through various mechanisms. Stimulation of testosterone production. Nitric oxide promotes the relaxation of the Leydig cells in the testicles, facilitating the entry of nutrients and oxygen necessary for the synthesis of testosterone. Improved blood flow. By dilating blood vessels, nitric oxide increases testicular blood flow, which translates into a greater supply of cholesterol, the precursor of testosterone. Optimization of cellular communication. Promotes communication between Leydig cells, ensuring correct hormonal signaling and efficient production of testosterone. Regulation of luteinizing hormone. Nitric oxide is involved in the regulation of luteinizing hormone, LH, enhancing its release through the stimulation of the pituitary gland, located in the brain. Here, nitric oxide acts as an amplifier of this signal, increasing the amount of LH released and therefore boosting testosterone production. An increased level of this hormone stimulated by nitric oxide, the luteinizing hormone, acts as a signal that orders the Leydig cells to produce testosterone. Protection against oxidative damage. Nitric oxide neutralizes free radicals, unstable molecules that can damage Leydig cells and affect testosterone production. Nitric oxide acts as a protective shield, neutralizing these agents and preserving the health and function of cells. Preservation of testicular function. By protecting Leydig cells from oxidative damage, it contributes to maintaining long-term testosterone production capacity. It is worth noting that nitric oxide is not only beneficial in preventing erectile dysfunction, but is also useful for the heart and general functioning of the body. Maintains cardiovascular health by dilating blood vessels, lowering blood pressure, and preventing blood clots. Good cardiovascular health promotes testosterone production indirectly, as it optimizes blood flow to the testicles and other organs in the body. In addition, it also regulates our stress hormone, cortisol, and helps improve sleep. A sleep problem like apnea increases the risk of erectile dysfunction. With respect to fertility or reproductive capacity, nitric oxide improves sperm motility by increasing the contraction of the flagellar muscles, allowing sperm to move more efficiently through the female reproductive tract. It has also been linked to improving sperm morphology and quality, which could contribute to greater male fertility. While erectile dysfunction can be a symptom of underlying health problems, it can also be caused by temporary factors. In these cases, it can improve on its own or with changes in your lifestyle. If you are experiencing problems getting or maintaining an erection, it is important that you see a doctor to determine the cause of the problem and receive the appropriate treatment. Fortunately, there are several treatments available for erectile dysfunction. Among medical treatments, we find oral medications and hormonal therapies. It is also important to address the psychological aspects with therapy and emotional support. Devices such as vacuum pumps and penis rings can help achieve and maintain an erection, and in some cases, surgery can help treat erectile dysfunction. Is there a way to increase the level of nitric oxide in our body naturally? If there is, making lifestyle changes, such as eating a healthy diet, exercising regularly, and reducing alcohol and tobacco consumption, can have a big positive impact. Maintaining a healthy diet can be an effective tool to prevent or improve erectile dysfunction. Various studies have shown an association between a nutrient-rich diet and better erectile function. Below, I give you a list of some of the foods that are recommended to be included in a diet to prevent and even reverse erectile dysfunction. Fruits and vegetables. They are rich in antioxidants, fiber, and vitamins that can improve cardiovascular health and blood flow, essential factors for proper erectile function. Fruits such as strawberries, blueberries, and watermelons are especially recommended. Other foods high in nitrates include celery, cabbage, and broccoli. Leafy green vegetables such as spinach, arugula, lettuce, and beets are excellent sources of nitrates, which the body converts into nitric oxide. Whole grains. They are a source of soluble fiber, which helps reduce LDL cholesterol and improve insulin sensitivity. This may be beneficial for cardiovascular health and erectile function. Cereals such as oats, brown rice, and quinoa are recommended. Legumes. They are rich in protein, fiber, iron, and zinc, important nutrients for general health and male sexual function. Legumes such as lentils, beans, and chickpeas are recommended. Fatty fish. They are rich in omega-3 fatty acids, which have anti-inflammatory properties and can improve cardiovascular health. Fish such as salmon, mackerel, and sardines are recommended. Nuts and seeds. They are rich in protein, fiber, vitamins, and minerals, such as zinc, which are important for overall health and male sexual function. Nuts such as walnuts, almonds, and hazelnuts, and seeds such as chia and flaxseed are recommended. Extra virgin olive oil. It is rich in monounsaturated fatty acids and antioxidants, which can improve cardiovascular health and blood flow. In addition to including these foods in your diet, it is important to limit consumption of red and processed meats, which can increase the risk of heart disease and affect erectile function. Reduce the consumption of saturated and trans fats found in fried foods, industrially baked products, and margarines. These fats can increase LDL cholesterol and decrease good cholesterol, HDL, which can harm cardiovascular health. Added sugar. Limit the consumption of added sugar present in sugary drinks, sweets, and processed products. Excess sugar can contribute to obesity, diabetes, and other health problems including erectile dysfunction. Salt. Reduce excessive salt consumption, since high blood pressure is a risk factor. Drink enough water. Adequate hydration is essential for the proper functioning of the entire body, including the cardiovascular system and erectile function. Consider some supplements, such as vitamin D or L-arginine, an amino acid that converts to nitric oxide. L-arginine supplementation may be beneficial in some cases of dysfunction, but it is important to consult with a doctor before taking it. Antioxidants such as vitamin C, vitamin E, and flavonoids help protect from oxidative damage. They are found in fruits such as citrus fruits, berries, and kiwi, as well as vegetables, dark chocolate, and green tea. It is important that you know that diet is only one aspect. Erectile dysfunction can have various causes, so it is essential to address all risk factors, including the management of chronic diseases. Diabetic patients are more prone to erectile dysfunction due to the destruction of endothelial cells present within the blood vessels. These endothelial cells are the body's main sources of nitric oxide. On the other hand, nitric oxide increases insulin sensitivity, which is essential for controlling diabetes. Also remember that some lipid-lowering medications, such as statins and fibrates, can also cause erectile dysfunction. Normally, nitric oxide decreases by 50% after age 40. If we can increase the level of nitric oxide, it will significantly solve the problem related to erection. Other strategies your doctor might recommend is sun exposure. Sunlight stimulates the production of nitric oxide in the skin. Saunas. The heat from saunas can temporarily increase nitric oxide production. Alternating hot and cold baths can improve blood circulation and increase nitric oxide production. In addition, a change in your habits and lifestyle would be very beneficial for your health in general. Avoid excessive alcohol consumption. Alcohol can damage blood vessels and affect erectile function. Maintain a healthy weight. Being overweight and obese can increase the risk of erectile dysfunction. Engage in regular physical activity. Exercise can improve cardiovascular health and erectile function. Quit smoking. Smoking damages blood vessels. At the beginning of this video, we talked about the morning erection. When you sleep, the level of the stress hormone is low, and your parasympathetic system must be activated. There are two nervous systems that work together in our bodies. One is the sympathetic system, and the other is the parasympathetic system, both responsible for erectile function. To achieve a healthy erection, it is essential that the parasympathetic nervous system, PNS, is active. The PNS is responsible for regulating bodily functions related to rest, digestion, and energy conservation, creating a favorable environment for the dilation of blood vessels in the penis. However, when the sympathetic nervous system, SNS, is activated in a dominant manner due to stress or anxiety, the erection can be affected. The sympathetic nervous system, responsible for the fight or flight response, triggers a series of physiological changes that go against what is necessary for an erection. In summary, erectile dysfunction is a common problem that can be triggered by several factors. Most of them are treatable. If you or someone you know is dealing with this, don't hesitate to seek professional help. Some men feel embarrassed to talk about their condition, but it is the only way to treat the problem by communicating honestly with your doctor and your partner. It is crucial to consult with a health professional to find the right treatment. There is no one-size-fits-all solution, and a doctor can help determine the best option for each individual and help you achieve a healthy, fulfilling, and happy sex life. Thank you for joining me. Don't forget to subscribe to our channel for more useful information and leave your comments. We would love to hear your experiences and questions. See you in the next video.